Hi, this is Kevin Dorn, City Manager of South Burlington, coming to you again with another one of our series of public service announcements, talking about how we are dealing with the COVID-19 crisis in our state and throughout the country, talking about following Governor Scott's guidelines on social distancing and wearing masks, on the reopening of our private facilities, our private businesses, and government, and many other things. And we'll get to those things a little later in this announcement. But right now, I think all of our focus for many of us, in fact, most of us in this country, has been around the tragic series of events in Minneapolis with the death of George Floyd and how that came about. And also the aftermath, the violence that has spread across this country as protests have turned violent in some cases. And to more fully talk about what we're doing here around policing, because I know many of you have questions about how we police here in South Burlington. I'm going to turn this over to Chief of Police Shawn Burke. Chief Burke is providing outstanding leadership of his team of officers at the police department. I have total faith in how he is managing and leading our organization, our department, and our officers. And he is expert on these matters, having studied them for many years. And so with no further delay, I'll turn it over to Chief Burke for his thoughts on what we're experiencing across the country. Chief Burke.
Thank you, Kevin. I appreciate that. I'll tell you that as this video began to circulate around police headquarters, the team here at South Burlington Police were absolutely outraged by the conduct of the officers in Minneapolis. Having said that, I think it's important to highlight, where we're at in the city of South Burlington as it relates to training our police officers and maintaining the vital trust that we need with our citizens in order to effectively police this city. I took over as chief in 2018, soon after we began a training curriculum with the Police Executive Research Forum entitled Integrating Communication Assessment and Tactics. Really what this is a training module that offers officers a wheel of decisions, and those decisions are aimed at slowing incidents down and bringing appropriate resources to bear in order to hopefully avoid a use of force. That's not always the case, but it is a goal of is to reduce the amount of force that the police need to use. And when we do need to use force, that we do so appropriately considering the sanctity of human life and ensuring that the force that we use is proportional to the situation at hand. Akin to that is our relationship with the Howard Community Outreach Team. We work extremely hard to front load crisis-related incidents with team members from Howard that can offer services and help de-escalate a number of these situations that we see, particularly not the one in Minneapolis, but in other videos that involve the police having a violent confrontation with a person in crisis. We've really buckled down and worked hard to improve our responses there. Another set of guidance that we use here constantly, which began under Chief Whipple's direction of the department, is President Obama's task force report on policing in the 21st century. We use the 6 pillars as outlined in that report as our guidance here, particularly when we're talking about building trust and legitimacy with our community. I firmly believe that the trust and legitimacy comes with having highly trained, professional, service-oriented staff that really embrace the philosophy of being guardians of a community as opposed to warriors protecting the police themselves or what we see as foes. When we talk about our work in maintaining our trust and legitimacy with our community partners, we also really adhere to the terms of procedural justice, where our community understands our goals in keeping the city safe. They understand that we're doing so in a fair way, in a consistent way, but that's not always easily understood. And I think, A critical intersect here is how race relations and a police force come together. And we have to recognize that there are those that live here in the city of South Burlington and everywhere that have been marginalized simply because of the color of their skin. That's a barrier in so many ways, and that systemic racism in our country has guided us in ways to think, and we really have to check in on our implicit bias. A goal here at the police department is to develop and either identify, develop, and implement more meaningful avenues of training and education for officers as it pertains to systemic racism in society and implicit bias. We want to be able to lower the barriers that exist inherently between the police and our marginalized neighbors. We're committed to doing so. And a meaningful example of work that we do is our school resource officer program. School resource officer program is not at all about the security of the school. It's actually about socializing the police and building relationships, in normalizing the police in a way that those that grow up here in South Burlington can understand that their local police are here to help, that it is not a vilified force looking to oppress any certain group. And then I think, Kevin, in closing, that government can't lead this on our own. We don't have the answers. This is really a time for us in government and us as a community to listen to everyone in our communities. There are citizens that are afraid to speak. There are citizens that are afraid to report misconduct on the part of police officers. And there are citizens in our community that have had lived experiences where government is not an ally. And we owe it this time, in the wake of what we've seen going on in Minneapolis, Georgia, and New York City, to reflect on what the lived experience of our neighbors has been, to not simply chalk this up that racism doesn't live here in South Burlington. That would be the equivalent of condoning racism. And listen and learn as a community and strive to be better public servants for the city of South Burlington. Thanks.
Thank you, Chief Burke. Those are strong and comforting words, I think, to members of the public during this time of real crisis in our country, as we come to grips with systemic racism and the other and these events that have occurred all too often in our country. I greatly appreciate your leadership and the dedication of your officers and team. We will strive to do our very best to provide the training, to provide the education, and maintain that commitment and that community policing here in South Burlington. So it's hard for me to segue back to the COVID-19 issue. I think all of our minds are on what is going on out across the country right now, but there are a few things that I did want to talk about. 2 weeks ago, the City Council passed a resolution that asks the owners of businesses and offices and organizations to require people to wear masks when they enter their establishment. Also in that resolution is a requirement that if people enter a city building, you will have to wear a mask. There's been a lot of feedback to the council, people wanting a more strenuous effort to require and mandate a face mask be worn in all public places. And the council will be taking that issue up again at a special meeting on June 8th. But I think it's important that we all understand exactly why health experts are asking us to wear these masks. When you wear a mask, it's not about your health, about protecting you. It's about protecting others. If you are wearing a mask in a public place where others are around, it shows that you are committed to not being a threat to their health. And so we'd like to see that in a place like South Burlington, where we know each other, where we're concerned about each other, that we all voluntarily use a mask to protect other people. Could be members of your family, could be your neighbors, could be a complete stranger who you see in a store or are walking across the street. But again, Wearing a mask is not about your health, it's about protecting others. And when you put it in that context, we hope that South Burlington residents and our visitors and those who work here will wear masks. Sometimes it feels like an inconvenience, but if you think about the importance of protecting somebody else's health, I think we can all agree that doing everything we can do to protect other people is what we're all about as humans. On another matter that I'm hearing from our emergency response teams, we have grown concerned that people are reluctant to dial 911 in this COVID-19 pandemic world right now. Perhaps concerned about going to the hospital, perhaps concerned about an ambulance ride or exposure to COVID-19 in some way. Our emergency response professionals strongly encourage that when you need help, when you need to get to the hospital, when you need to have a medical professional come to your house, that you call 911. It's critically important that even as we are concerned about COVID-19, that underlying medical conditions that may be extremely severe and life-threatening even are still addressed in an appropriate way by calling 911. I can assure you that our team members all have personal protective equipment. They're all highly trained in how to keep you safe in an ambulance environment or when an ambulance team arrives in your home. So please, please do not hesitate. Call for help when you need it. Call 911 when you need it, and our professional teams will arrive and assist you in whatever you need. I do want to go back to a recurring theme that I have brought out in past announcements. Our first response team, our essential employees have continued to work throughout this entire pandemic. So we have a fully staffed police department, fully staffed ambulance teams, fully staffed fire department, fully staffed water quality division. All of our vital services continue to be provided just as they always have been. And I would add to that, that our colleagues and partners at the Champlain Water District continue to provide pure, safe water for all of our residents, and most of you are on public water systems. So you can be assured that the vital safety and health needs of our community continue to be addressed by our professionals and our tremendous team of healthcare and security professionals. We continue to address budget-related issues and concerns about dwindling revenues that are projected for the end of this fiscal year, which ends on June 30th, and into next fiscal year. And as a result of that, we have furloughed 43 of our employees. These are deemed non-essential employees. I still continue to believe they are very, very important employees. But these are folks who are working in our library, in our Department of Public Works, and as a result of, and in our City Hall as well. Some folks are able to work from home, and that's working out quite well. Most of our furloughed employees are still working part-time, and we have a few of our employees who are furloughed 100%. We hope to emerge from this within the next month or so and get our entire team back to work. But in the meantime, some of the things that you will expect from the city, mowing of grass on public spaces, line striping on the streets, filling potholes, doing some things like that are likely to be delayed. And we're asking for your patience. We could face between a $2 and $3 million shortfall in fiscal year 21. And we, as I've stated in prior messages, we implemented an immediate freeze on spending back in March when the first signs of having to shut down started to occur, a hiring freeze. And we presented to the council a plan to reduce spending in certain areas where we have discretion. And some of those were very hard. Our paving budget, has been cut in half for fiscal 21. We've suspended the purchase of any new vehicles, our fleet purchases, and we've gone to places where we have some discretion about spending. Again, that's going to mean that some of our services are going to be delayed, or some won't be provided in a manner that you're used to. But as soon as we can get back to a regular schedule, we will do that. And as soon as we know or have a better idea of what our revenue projections are going to be, we feel the prudent thing to do is to hold off on spending where we can, even though it may degrade some of the services we're providing. But still, we think it's the important thing to do. So that's our message today. We're dealing with two huge issues in our country. The health of our population with COVID-19 and the impact that's had on the lives of individuals and our whole population, as well as our economy. And this tragedy that has occurred in Minneapolis and the repercussions of that as they fan out across the country. But be assured that the vital services that you need for health and for safety in our community continue to be provided. And I want to end by saying thank you for what you're doing. Governor Scott and our health professionals put all the credit for the decline in COVID-19 positive cases and deaths in our state to you, the public, who've taken social distancing seriously, who've worn face coverings out in public, who've done the right thing for your fellow South Burlington resident and Vermonter. Let's keep doing this together, and together we'll get through all of this.